Hello everybody and welcome to lyranara.com and lyranara.me, the place where you can find the most powerful holistic diagnosis and therapy tools, as well as some of the most awesome natural supplements that you can get anywhere. And today we have another great presentation for you, and it's about a holistic cancer therapy that really works. And without further ado, let's dive right in and learn more about it. And I would like to commence this presentation with what we call the rule number one of cancer. And what we mean by that is that diseases are meaningful biological programs aimed to trigger your attention to solve a conflicting situation that is disturbing your whole body. Diseasing and healing processes are divided into well-defined biological phases, all of which can be identified, they can be measured, and are part of a system that makes it possible to make a clear prediction of events and health developments. And rule number one, therefore, is that every cancer starts with a psycho-emotional conflict, which is a serious, dramatic, and isolating conflict shock experience. It manifests simultaneously on three levels: your psyche, your brain, and the organs. And the content of the psychic conflict determines the location of the brain edema known as the hammerhead and the location of the cancer in the organ that is controlled by that brain area. And when the conflict shock occurs, a cellular short circuit happens in a predetermined place of the brain, and you can see this in the CT picture on the right. The cells in the HH lose their bipolarity, and this can be seen with computer tomography. Later on, when the conflict is resolved, the CT images change, showing that the HH edema gets into regression and finally appears as a scar tissue of the brain. As soon as the HH appears, the organ controlled by the specific brain center registers an anatomic, physiological, as well as functional transformation. And this transformation can manifest as a growth, which is a tumor, as tissue loss, which are ulcers, or as organ malfunctions. This unanticipated event or biological shock can happen at any time in our everyday lives, and it determines which cancer or cancer equivalent disease will make you sick. No illness, except for poisoning or major accidents, trauma, or iatrogenic diseases, can occur without a shock or an unanticipated event. The reason why specific conflicts are indissolubly tied to specific brain areas is that during our historical evolution, each part of the brain was programmed to respond instantly to conflicts that could threaten our survival. And while the old brain, which is the brainstem and the cerebellum, is programmed with basic survival issues that relate to breathing, eating, and reproduction, the new brain, which is the cerebral medulla as well as the cerebral cortex, is encoded with more advanced themes such as territorial conflicts, separation conflicts, identity conflicts, as well as self-devaluation conflicts. So with that in mind, let's go over a list of all the possible conflicts. First up is the so-called morsel conflict, which refers to how we handle what life throws at us, such as traumas, bills, accidents, deadlines, moves, relationships that matter, job losses, financial losses, betrayals, accidental death of a close person. We can summarize all of those as the big bad news. And all of these conflicts affect the digestive tract organs, which develop from the endoderm. When a morsel is thrown at us, we can grasp it with the mouth, swallow it down through the throat, esophagus, break it down into pieces in the stomach, separate the good from the bad in the small intestine, or forgive and let it go through the large intestine and the rectum. And depending on the level of the morsel indigestion, the cancer will affect one of the mentioned gastrointestinal organs. Second possible conflict is the so-called attack-zoid conflict, which is an attack with words, fights, weapons, surgery can be that, sudden dysfunctionality of a part of the body, and many more of that kind. These conflicts are sudden and unexpected and can be verbal and physical assaults, attacking your body and your reputation. It is often perceived as being defiled, touched by something that tarnished you. In a soil territorial conflict, the deep skin and the membranes inside the body that function as the protective layers of all organs developed from the mesoderm are affected. Third is the so-called territorial conflict, which constitutes a violation of your territory, of your possessions, your authority, your social hierarchical position, and we want to feel secure in our turf. Inability to mark your territory to prevent encroachment is affecting the kidney and the bladder. You feel fearful and insecure. Sometimes this is also associated with anger and outrage. And these conflicts affect the ectoderm, the epidermis, which is your outer skin, as well as the linings of ducts and mucosal and serous linings. Next up is the so-called pack conflict, which is characterized by our relationship with other members of our family, colleagues, friends, well, the pack we rely on. And this kind of conflicts include mating, nurturing, separation, as well as divorces. And the organs belonging to the ectoderm are affected by this kind of conflicts. And last here on the list is the so-called self-devaluation conflict, which occurs with chronic negative thoughts about ourselves. These thoughts may be adopted in a childhood trauma or repeated by adult remarks about our abilities. In a sense, we are attacking ourselves. I'm slow, I can't run fast, I'm useless, I'm fat and not pretty, etc. Things like that. The tissues that are impacted by those kinds of conflicts are the lymph nodes, the tendons, the blood vessels, and your bones. And the tissue affected is part of the mesoderm. Commonly, those are joint problems, bone, as well as lymphatic cancers. And here you see a list of the conflicts and the specific organs that are affected by them. On the left, you have the brain area and the associated tissue. And on the right, you have the stress or the conflict that damages those germ layers. For example, the first up is the brainstem-controlled endoderm, the innermost functioning tissue of digestion, elimination, and procreation. All digestion, the pancreas, the liver, the thyroid, the lung alveoli, the kidney collecting tubules, the bladder, the uterus, fallopian tubes, as well as the prostate. And a typical conflict to cause damage to those organs is the physical survivability and procreation conflict, which means I can't make it, you're not able to perform a survival task or to process a life event. Other possible metaphors for this type of conflict, I cannot take it, I cannot handle it, I cannot get over it, etc., etc. So those are indigestible morsel conflicts, or isolation, abandonment by those that are counted on for survival, especially starvation, a death fight, typically from a diagnosis, could be also that kind of a conflict. Next up, we have the cerebellum-controlled mesoderm, which is the deep skin and your membranes, and damages to those parts of your body are caused by social survivability, safety, and security conflicts, like I'm being attacked, I'm being soiled. Other conflict metaphors could be I couldn't stop it, I couldn't defend myself, that hit me like ... that grossed me out. It's called a nesting conflict. Next up, we have the cerebral medulla controlled mesoderm, which are your bones, your cartilages, your tendons, your connective tissue, skeletal muscles, all of your joints, the blood vessels, the lymph nodes, the smooth muscles of the intestines, the myocardium, kidney parenchyma, adrenal cortex, ovaries and testicles, your whole lymphatic system, as well as your spleen and your uterine musculature. And conflicts that cause damage to those parts of your body are doubts about physical survivability and self-concept, which could be expressed like I don't measure up. Other conflict metaphors are self-devaluation conflicts, unfair remarks, judgments, being put down like I can make it, not good enough, you're a failure, you're useless. All of those can trigger a loss of self-confidence or humiliation of the territory. Next body part that we're going to talk about is the cerebral cortex control ectoderm, which are the linings of all organs, your vessels, your ducts, your squamous cell linings, your tooth enamel, your nails, your retina, and your cervix. And damages to those parts of your body come from doubts about social survivability and safety, as well as security, relationships within the pack or with respect to the territory, again, like I am helpless in my territory. Other possible metaphors for pack conflicts and territorial loss is territorial fear, territorial marking, separation, as well as infringement. So it's about territorial control and disgust. And here you can also see on the right that we have another list with the location of the bone and joint deterioration and the metaphor or empirically determined self-devaluation conflict that causes it. So for example, for your cervical spine, those are issues with injustice. For example, unfair court sentences, problems with your spine come from the evaluation of your life's work and purpose. Problems with your shoulders often stem from relational SDCs, for example, failure in a relationship. Your hip problems are related to being unable to endure or manage something, and knee problems come from conflicts that are related to physical performance. And here we have more possible conflicts and their corresponding cancer locations. So generally hopelessness, despair, and meaninglessness create chronic stress, which prevents the healing from cancer and other diseases, but they are not the cause. The following list shows you therefore some of the relationships between the conflict cause and the cancer-affected organs. And first up is the adrenal cortex, which is caused by the wrong direction or you've gone astray. Bladder problems, ugly conflicts, dirty tricks, no marked territory. Bone problems, lack of self-worth, inferiority feeling. Breast milk gland involving care or disharmony. Breast milk duct, it comes from a separation conflict. Breast left and right-handed, problems with that come from the conflict that are concerning the child, the home, or the mother. Breast right-handed, conflict with a partner or others. Bronchial problems, territorial conflicts causing those. Cervix problems are caused by severe frustration. Pancreas problems by anxiety, anger conflicts with family members, as well as inheritance problems. Prostate problems from ugly conflicts with sexual connections or connotations. Rectum problems from fear of being useless, ugly. Skin problems from loss of integrity. Spleen problems from shock of being physically or emotionally wounded. Stomach problems from indigestible anger, swallowed too much. Testes and ovaries, it's a loss conflict that is causing those problems. Thyroid problems by feeling powerless. Uterus problems and sexual conflicts cause those. Colon problems are caused by ugly indigestible conflicts, and mouth problems by you cannot chew or hold it. And here some more conflicts and the affected organs. Diabetes and hypoglycemia. Well, this is caused by a right-handed female that develops hypoglycemia from anxiety and revulsion. If left-handed, she develops insulin-dependent diabetes. A right-handed male develops insulin diabetes from a conflict of resisting or struggling against something. If left-handed, he develops hypoglycemia. Heart infarcts are caused by fight for territory or its content. Hemorrhoids, both a right-handed woman with an identity conflict and also a left-handed man with territorial anger. In the healing phase, we get hemorrhoids, multiple sclerosis, as well as paralysis. Comes from an inability to escape, not knowing how to escape and what to escape. Facial paralysis, fear of losing face, having been made a laughingstock. Psoriasis involves separation conflict concerning the mother, the father, the family, the home, your friends or pets. Vitiligo and leukoderma comes from ugly or brutal separation conflicts. Next up, let's explore the connection between cancer, your organs, and the brain. And here on the left side, you can see the brainstem organ relation, and on the right hand, you can see the cerebellum organ relation. And about the brainstem organ relation, in the brainstem, the control centers of the organs of the intestinal canal and its descendants are arranged in a ring form order, as you can see, starting on the right hemisphere with the brain relays of the mouth and the pharynx, lung, alveoli, esophagus, stomach, liver, parenchyma, pancreas gland, duodenum, small intestine, continuing counterclockwise with the brain relays of the appendix, cecum, colon, rectum, and bladder on the left side of the brainstem, as you can see. And about the cerebellum organ relation, the cerebellum next to the brainstem controls the skins, such as the corium or the outer skin, the pleura, the peritoneum, the pericardium that protects the body, and the vital organs as well as the breast glands. But there are more connections between cancer, your organs, and the brain. And here you see on the left the relationship between the cerebral cortex and the motor cortex, and on the right the cerebral cortex organ relation. And in the cerebral medulla, the brain relays of the skull, your arms, your shoulders, your vertebrae, your spine, your pelvis, your hip, your knees and feet are orderly arranged from head to toe, as you can see. And about the relationship between the cerebral cortex and your organs, the cerebral cortex is divided into a premotor sensory cortex and a motor cortex, as well as a sensory cortex and a post-sensory cortex with the periosteum, coronary arteries, coronary veins, the cervix, the rectum surface mucosa, the stomach, the bile ducts, the pancreatic ducts, renal pelvis, the ureters, the bladder, as well as a visual cortex, which is the retina and your vitreous body. Alright, next up is our rule number 2 for cancer. And it is that every disease has two phases. First phase is a cold phase or a conflict active phase with which each disease begins and which lasts as long as the conflict is not solved. And the second phase is the hot phase when the conflict resolves. This phase is also known as the healing phase. The two phases can be thought of or compared to the rhythm of a lasting day and a lasting night. It is important to know that less than 30% of all symptoms appear during the conflict active phase and over 70% appear when the conflict has already been resolved. Normotonia as well as sympathicotonia and vagotonia are terms that relate to the autonomic nervous system, which controls the vegetative functions such as sweating, respiration, digestion, excretion, constriction of the blood vessels, as well as your heartbeat. Normotonia indicates a balanced day-night rhythm where the sympathicotonia alternates with the vagotonia. During the day, the organism is in a normal sympathicotonic state of stress, which is the fight or take flight state. During sleep, in a normal vagotonic state of rest, which is rest and digest. The sympathicotonic phase lasts roughly from 4 a.m. to 8 p.m. and the change of the vegetative rhythm is an important diagnostic criterion for establishing whether a person is in the conflict active phase or already in the healing phase. And when the conflict occurs, the normal day-night rhythm is instantly interrupted and the autonomic nervous system switches into lasting sympathicatonia and a prolonged state of stress with nervous restlessness, a fast heartbeat, elevated blood pressure, slow digestion, frequent urination, as well as little appetite. And since the blood vessels are constricting during stress, typical signs of conflict activity are cold hands, cold sweats, as well as the shivers. We therefore call the conflict active phase also the cold phase. The psyche is in a compulsive thinking mode. The constant dwelling over the conflict causes sleep disturbances such as waking up shortly after falling asleep, usually around 3 a.m. The extra waking hours and the total focus on the conflict serve to find a resolution. In unison with the psyche and the autonomic nervous system, the conflict-related organ responds with physical changes that serve the biological purpose to improve the function of the organ so that the individual is in a better position to cope with the conflict. If more tissue is required to facilitate a conflict resolution, the corresponding organ generates cell proliferation during the conflict active phase or the so-called adenocarcinoma. This process applies to all organs and tissues that are controlled from the brainstem and the cerebellum, such as your lungs, your liver, your pancreas, your colon, your thyroid, and your breast glands. If less tissue is required to facilitate a conflict resolution, the organ or tissue responds with cell loss, which are ulcers or bone cancer. This process applies to all organs and tissues that are controlled from the cerebral medulla and the cerebral cortex, such as the bones and joints, ovaries, testicles, coronary arteries, coronary veins, the cervix, the bronchi, the larynx, and your skin. A hanging conflict refers to the situation when a person remains in the conflict active phase because the conflict cannot or has not yet been resolved. Those who don't make it through the conflict active phase die as a result of energy loss, weight loss with protein depletion, sleep deprivation, and above all, because of the fear of the disease, particularly the fear of cancer. So how can we resolve those conflicts? Well, conflicts always originate from real-life circumstances brought on, for instance, by problems with a spouse, which are separation conflicts, or the death of a loved one, which are loss conflicts, troubles at work or in school, which are territorial conflicts, as well as self-devaluation conflicts, also financial difficulties, which is a starvation conflict as well as a morsel conflict, worries about a family member, which are nest worry conflicts, or concerns about oneself, which are existence conflicts, death fight conflicts. And trying to find a practical solution is therefore the best as it is the most lasting. The loss of a workplace, for example, could be dealt with by picking up an old hobby. Constant territorial anger with a neighbor might require a move. Sometimes conflicts resolve themselves, for instance, when life circumstances change or when other matters gain more priority. During the first part of the healing phase, we see water retention and inflammations, but the tumor stops growing. This eventually leads to a healing crisis, also known as the epileptoid crisis caused by the hammerhead brain lesion. It shows unique symptoms for each illness. After this, the body starts to expel the accumulated water and the patient gradually regains strength and body functions become normal again. Now, the connective tissue in the brain, the glia, starts repairing the hammerhead. This may be interpreted by conventional radiologists as a fast-growing brain tumor and treated accordingly. So real brain tumors do not exist as nerve cells in the brain cannot divide. Majority of brain events such as strokes, bleeding into the brain, cysts and tumors are due to the healing events of the hammerheads. During the healing crisis, also the patient may, for a short time, re-experience the original psychological conflict with cold hands and cold sweat. This serves to suppress and eliminate the edema in the brain lesion, which then allows other body conditions to normalize. The main danger point is just before the end of the healing crisis, when it will become apparent if the body is strong enough to eliminate the disease. In difficult cases with long or strong conflict duration, massive brain edema may develop, for which we use an assortment of anti-inflammatory therapies instead. What Hammer calls the epilepsy crisis may be experienced by the patient as a heart attack, lung embolism, hepatitis, or lung infection. Generally, during the healing phase, the patient will have more discomfort than when the tumor was actively growing. In the first part of the healing phase, most problems are due to water retention, as well as inflammations and swelling of tissue that can cause a lot of pain. Hammer regards the edema, whether found in the brain or in an organ, as positive and a sign of healing. On a spiritual level, conflicts that we are facing are an invitation to reconsider our general life attitude, letting go of anger, viewing the situation from a different angle, trying to see the larger picture, understanding the position of the people involved, and to practicing forgiveness and loving kindness as the true source of all healing. Next, let's talk about a cancer healing phase, PCL-A. Tumors that developed in the conflict active phase, such as lung tumors, colon tumors, liver tumors, prostate tumors, or a tumor in the breast glands, immediately stop growing, and the extra cells that are no longer required are broken down with the help of microbes or are encapsulated, hardened, or necrotized. This applies to all organs that are controlled from the brainstem and the cerebellum. Conversely, though, cancer with cellular loss in the cervix, your ovaries, your testicles, your bronchi, your milk ducts or bile ducts are refilled and replenished with new cells. In conventional medicine, the new cells are wrongly regarded as cancer cells, though. This applies to all organs and tissues controlled from the cerebral medulla and the cerebral cortex. In the conflictolysis phase A, which is PCL-A, or the exudation phase, as it is also called, an edema forms at the cancer site to protect that area that is just healing at that time. Water retention is exceedingly stored in the healing area, enlarging the swelling and enhancing the local pain sensation. Other signs of healing are fever and inflammation because of the increased blood flow into the healing tissue, the discharge to expel the byproducts of the cell removal process, itching when epithelial tissues such as the skin are affected, and night sweats when fungi and TB bacteria are involved. The swelling and inflammation can cause considerable pain. The severity of the healing symptoms is determined by the intensity of the preceding conflict active phase, and many of the wounds healing symptoms such as pus, inflammation, swelling, pain occur also in cancer healing. If the patient has been made aware of all the symptoms, he will no longer need to get frightened by these symptoms. In the greatest number of cases, the whole episode will pass without any serious consequences. Also, the affected neurons in the hammer-hurt brain undergo a restoration process. Like on the organ level, during the first part of the healing phase, which is PCL-A, water and serous fluids are drawn to that area, creating a brain edema to protect the brain tissue during that healing period. The extent of the edema is determined by the intensity of the preceding conflict and the size of the hammer hurt created at the moment of the conflict. Strong headaches start in the healing phase and are most intense during the epileptoid crisis. In general, the brain edema is nothing to worry about. Next, we enter the cancer healing phase, PCL-B. Passing the epileptoid crisis is like turning a corner. Now your organism enters the second part of the healing phase, which is called PCL-B, or the so-called scarification phase. Scarring occurs predominantly through the production of collagen manufactured by specialist cells called fibroblasts that are located in the connective tissue around the healing area. And by the end of PCL-B, the original function of the organ is restored and the day-night rhythm returns to normotonia. After the brain edema has been pressed out, glial cells proliferate at the site to finish the healing process on the cerebral level. Neuralgia is brain connective tissue that insulates and supports neurons. Only 10% of the brain consists of neuronal cells. 90% is made up of glial cells, which indicates their importance, of course. A major distinction between the two types of brain cells is that neurons do not divide by mitosis, while glial cells have the ability to multiply. Similar to the role of connective tissue in wound healing, the function of neuroglia is to repair brain damage, for example after brain injury or brain surgery. Glial cells also help to restore the area in the brain that received the impact of a psychoshock conflict. Intense conflict activity as well as the brain edema in PCLA stretch the synapses, which is the junction between your nerve cells, putting stress on the insulation around the neurons. During the healing phase, glial cells mend the neural sheath by forming an additional insulating layer, and this repair work is crucial to ensure a normal function of the organ that is controlled from that particular brain relay. Neuroglia starts restoring the brain relay from the periphery. This is in clear contradiction to the established theory that a cancer, including a brain cancer, goes through continued cell augmentation, leading to the formation of a tumor. In the second CT image here on this slide, you can see a more advanced healing phase with an accumulation of neuroglia in the area of the brain that controls the cervix. In the third image, you can see that after the healing has been completed, the scar tissue in the affected brain relay appears on a CT scan as a washout pattern. In conventional medicine, the natural buildup of neuroglia is wrongly believed to be a brain tumor termed glioma, glioblastoma, or astrocytoma, referring to the star-shaped form of the glial cells. The classification of brain tumors, grade 1 to 4, is based on the density of the glial cells. Grade 4 is considered the most aggressive, with the propensity to spread throughout the brain. If more than one tumor is found in the brain, the diagnosis reads multiple brain metastasis, which usually triggers instantly a new life-threatening conflict with carcinoma in the lungs or kidney ducts. Dr. Hammer demonstrated this already in the 1980s, that so-called brain tumors are not cancers, but instead an indication that a natural healing process is taking place in the brain parallel to the healing of the corresponding organ. Next, we need to talk about a so-called cancer hanging conflict. A hanging conflict with a hanging healing refers to the situation where the healing phase cannot be completed because of continuous conflict relapses. When we experience a conflict, our mind is in a state of acute awareness. Highly alert, our subconscious picks up all components considered as relevant in association with the conflict situation. In GNM, we call the imprints that remain in the aftermath of a DHS conflict tracts. Tracts are, for example, the location where the conflict took place, a person or pet that was involved, the taste of a particular food, specific sounds or noises, the weather conditions, a certain scent, certain words, a voice, a gesture, and so forth. Tracks can be highly emotional. In fact, feelings such as fear or distress itself can become a track. Other tracks stored in the biological memory are more subtle, for instance, a food ingredient or a certain pollen. The biological purpose of the tracks is to function as a warning signal in order to avoid experiencing the conflict a second time. In the wild, these alarm signals are vital for survival. If we are in the healing phase and all of a sudden encounter a track, either through direct contact or by association, the original conflict is instantly reactivated, unfortunately, and each conflict relapse interrupts and therefore prolongs the healing process on the organ and in the brain, leading to a chronic condition. Persistent skin conditions like dermatitis and psoriasis, as well as arthritis, Crohn's disease, Parkinson's disease, chronic fatigue syndrome, or constant low blood pressure are very good examples of a hanging healing. Like with a healing wound that is torn open again and again, with conflict relapses, the affected organ heals only very, very slowly. And this is why we should try to resolve a conflict as soon as possible. Also, as a side note, a new conflict and extreme stress also interrupts the healing, and this includes states of fear and panic. Tracks also have to be taken into consideration when we are dealing with recurring conditions, such as recurring colds, skin rashes, diarrhea, hemorrhoids, infections, or recurring cancers and allergies. And so we come to our rule number 3 of cancer. Taking into account the development of the fetus, you can better understand the correlation between the psyche, the brain, and the organs, which are closely connected to the 3 embryonic germ layers, the endoderm, the mesoderm, the ectoderm, from which all organs of the human body originate. The rule number 3 of cancer shows that the location of the hammerhead in the brain, as well as the cell proliferation or cell loss following a psycho-emotional conflict, are not accidental, but part of a meaningful biological system inherent in every living organism. Through analyzing and comparing thousands of brain scans, Dr. Hammer found that organs originating from the same embryonic germ layer are controlled from the same part of the brain. All organs that derive from the endoderm are controlled from the brain stem. Primitive life forms such as bacteria have only the endodermal functions. All organs that derive from the old mesoderm are controlled from the cerebellum. All organs that derive from the new mesoderm are controlled from the cerebral medulla, and all organs that derive from the ectoderm are controlled from the cerebral cortex. Some organs, notably the colon, originate only from one embryonic germ layer. Others, such as the kidneys, are made up of tissues that derive from all 3 germ layers. Over time, the tissues merged for functional purposes and formed one organ or organ system, like your reproductive system, your digestive system, renal, respiratory, as well as your circulatory systems. And this explains why parts of one organ have their control centers in different areas of the brain. In the body, organs of the same germ layer origin, for instance the larynx, the cervix, the coronary veins, your rectum, bladder, are not always grouped together. In the brain, however, their control centers are positioned side by side in perfect order. Each of the 3 embryonic germ layers corresponds to very specific conflicts that date back to the time when the life-threatening crisis, which is of course again an existence conflict, starvation conflict, water conflict, or a territorial loss conflict, when those conflicts occurred. And so we arrive at rule number 4 of cancer. For the first 2.5 billion years, microbes were the only organisms inhabiting Earth. Gradually, they populated other life forms, including plants, animals, and us humans. Owing to their symbiotic relationship with the human organism and their vital role in maintaining the body tissues, microbes have become indispensable for our survival. The placenta that connects the developing fetus to the uterus is not sterile, as previously thought, but harbors a rich collection of bacteria. Hence, bacteria assist the healing process already in the organism of the fetus. The theory that certain diseases are caused by pathogenic microbes is one of the most persistent doctrines of modern medicine. This general conception is largely attributable to the fact that microbes are present at the site of a diseased organ. And since the activity of microbes is accompanied by swelling, fever, inflammation, pus, discharge, and pain, microbes are believed to be the cause of infectious diseases. Similar to the idea that an abnormal growth of cancer cells leads to the development of the malignant tumor, it is wrongly assumed that microbes growing beyond their normal ranges result in virulent infections. Microbes are endemic. They live in harmony with all organisms of the ecological milieu in which they have developed over millions of years. Contact with microbes that are foreign to the human body, for example, through traveling abroad, does not cause per se a disease. However, if, let's say, a European happens to resolve a particular conflict in the tropics and comes in contact with local microbes, the related organ will use them for the healing process. Since the body is not accustomed to these exotic microorganisms, the healing symptoms can become more severe. White blood cells, such as leukocytes and lymphocytes, support the microbial work. Governed by images of a biological warfare raging within the human organism, conventional medicine interprets a rise in white blood cells, so-called killer cells, as an immune response aimed at attacking and fighting the infection. In light of rule number 4, the academic construct of an immune system envisioned as a defense system against microbes and cancer cells, by the way, becomes entirely meaningless. In fact, the term infection itself becomes obsolete. The invention of autoimmune diseases in which the immune system apparently attacks the body's own tissue shows how a scientific culture can become blinded by its own beliefs. Many of us will at one time or another experience a conflict and get cancer. But don't worry, that is a normal part of life and not such a bad thing at all once you understand the principles of the biological rules of cancer. There is no general answer as to how to resolve a conflict. The resolution of each conflict always depends on the individual circumstances. However, a practical solution is usually the best and most lasting. Since the healing symptoms are always proportional to the intensity and the duration of the conflict active phase, we should always try to resolve a conflict as soon as possible. If a conflict cannot be resolved at a time due to constraints or because of its emotional intensity, downgrading the conflict is a most important step. Reducing an intense conflict, for example, through finding partial resolutions, a change of attitude, or a distraction, also decreases the symptoms on the organ level, for instance, the size of a tumor. Thus, a downgraded conflict mass also provides better conditions for going into the healing phase. This is preventive medicine at its best. During the conflict active phase, there are rarely noticeable physical symptoms. Cancers that develop during that period, for example, lung cancer, glandular breast cancer, prostate cancer, uterus, colon, liver cancer, or pancreas cancer, are usually only detected during the routine checkups through early screening strategies or medical exams that are targeted to find out whether a cancer has spread. Exoscopies, needless to say, that these procedures can trigger new conflicts, such as death-fright conflicts, care-fright conflicts, self-devaluation conflicts, and the like, causing additional symptoms including more cancers. Concerning the treatment of conflict-active symptoms, it is most important to find strategies and ways to resolve the related conflict and, as a next but equally important step, to be prepared for the healing symptoms, which are predictable as we have seen. Low energy, fatigue, headaches, swelling, pain, inflammations, fever, night sweats, pus, discharge, so-called infections and certain types of cancer are typical symptoms indicating that a related conflict has been resolved and that a correlating organ or tissue is now undergoing a natural healing process. Fear causes stress that is detrimental to healing also. Fear drains the body of its healing energy. Panic triggers new conflicts and reactions in the body which hamper the healing process. A typical response, for example, is water retention as a result of an existence conflict or hospitalization conflict. What else do we need to understand about conflict resolutions? Well, the main task in every case of cancer is to find the original emotional shock experience and make sure that it has been healed or is being healed right now. In many cases, it will have been corrected by itself and the patient suffers from an effect of the healing phase. For instance, someone may have lost a farm or a business but has now started another satisfying venture or hobby. As after effect, there may now be a tumor that gradually becomes dormant or eventually disintegrates. About 40% of tumors discovered during routine medical investigations are said to be old and harmless, that is dormant and calcified. However, complications may still arise if medical intervention now instills a fear of death, conflict shock that induces the same or another tumor to grow. In other cases, the original conflict may still be active or there may be a second active conflict. As we do not know, we have to probe in every case to find the original and any other conflicts. We need to think back, especially 1 to 2 years before our problem started, and analyze our emotional history during this time as well as before and after. Also, meditation and regression therapy may be useful to discover conflict shocks. If we still have a strong emotional response when we discover the content of the conflict, then we can be sure that it is still unresolved. If at all possible, it is best to solve it in a natural way. For instance, if it was caused by losing a partner, then find someone new. If you lost a child, become pregnant again or adopt a child or buy a pet. Cancer does not continue to grow after the 3rd month as pregnancy has priority. If a natural solution is not possible, use guided imagery either on your own or with the help of a partner or a suitable therapist. In a relaxed and meditative state, recreate and re-experience the conflict as intensely as you can, but then substitute a desirable or acceptable outcome. Create and experience this new outcome as vividly and detailed as possible. See it, feel it, and possibly even hear and smell it. The original experience may also have imprinted you with the memories of unrelated details of your ordeal, the tracks of which we talked about, to which you may now react with allergies. You may try to overcome this in the same way with guided imagery. If neither of these methods is possible because you feel that you have to continue your present duties or deal for whatever reason, then only increased spiritual understanding and acceptance may be able to help. In either case, be aware of your vulnerabilities and avoid any further conflict shocks, but if one does happen, get it out of your system as soon as possible. Forget and forgive. Alright, so now we've talked about how to resolve the conflicts, which is the most important part, but another important part is, of course, how to repair the damaged tissue. And during the healing phase, patients and doctors must work together to repair the tissue and reestablish the optimal functionality of the affected organs. And how can you do this? You can soften the symptoms and pain, secure a healing process without fatal and critical incidents, manage properly the associated symptoms by using, for example, the fantastic supplement Vivid Artemisinin that you can get, of course, at lyra.me. Highly and pure, concentrated and pure DMSO and Herbesso products, the great Veget Balance galvanic therapy system, the Aquatone and the Trimate CGI. You can re-establish, and you should re-establish cellular communication by increasing the cellular membrane permeability and potential. And here we highly recommend the Geno 62 and again the Veget Balance system. You should eliminate toxins and energetic blockages. And here the best systems that we know of are the Med Matrix and the Aquatone that you can use at home even. Also recommended is to replenish the intestinal microbial flora and combat lactic acidosis. So you should change your nutrition and use the right supplements as well as DCA therapy that might be helpful. And then fifth, train your autonomic nervous system for an optimal autoregulative activity. Nothing easier and better than using the amazing Kindling Easy system as well as the biotonometer. And all of those devices as well as supplements mentioned in this slide you will find, of course, as a link in the description box below. Alright, that was a lot of information, and I'm really glad that you stick with me. So let's sum it all up and make it easier to remember. First, a cancer therapy that always works must address all of the stressors which trigger and control your cancer, which means your psychological conflict is the major trigger, a nervous system is the control tower, and the organ and tissues are local cancer manifestation areas. And general lifestyle is the epigenetic factor and is more important than the genetic factor, which makes up only about 2%. So you must educate yourself to better understand what is going on in your body, which symptoms you must expect that we talked about, which are the phases of your disease, and finally to accept the right therapy and know all of your options very well. Cancer, as well as all of the other diseases, are biologically meaningful processes to help solve problems in your life. Conflict resolution is next up. All cancers start with an emotional, psychoshocking conflict, as we've discussed, and the development of cancer follows the path from the psyche to the brain to the tissues and your organs. The conflict type and the intensity determines the cancer type, the localization, as well as the severity of the cancer development. Everything is controlled by the ontogenetic relationship between your psyche, the brain, and the organ relays. Cancer healing starts always with the psychological conflict resolution, and there is non-successful cancer therapy not based on this. The faster and more authentic you solve the conflict, the better and faster your healing process will be. Most of the time you see a doctor during the healing phase because most symptoms appear then. What we've also learned, the third point, important point, is that detoxification and lifestyle changes are crucial. Worst toxins are those created by your own body when it is in a psychoshock state, plagued by negative thoughts and emotions, and it is then when your cancer starts. During the psycho-conflict active phase, you lose energy and get weaker, the cells are degenerating, they are missing the necessary nutrients, or are stuffed with cellular waste due to malfunctioning of the cellular membrane. And you must therefore detoxify your body to eliminate your own cellular waste, your chemicals which were given to you as medical drugs, as well as change your lifestyle and especially energize your body. Cancer is not deadly, but it is a lack of energy that is the single biggest reason for death. And last point that we need to sum up is that you need to repair the tissue and re-establish optimal organ functionality. For the healing phase of a cancer the body uses its own embedded healing mechanism, and sometimes microbes are its best helpers. However, most of the unpleasant and critical symptoms appear during this phase, and you need the professional assistance of a qualified healthcare giver to soften the symptoms, eliminate eventual risk, reduce pain, as well as inflammations. We mentioned in this presentation some excellent therapy tools that, again, I'm going to link in the description box below, but always ask also your doctor and especially your natural health practitioner for help and advice. There is no cancer which cannot be healed, and a single cancer therapy that works must support your body's own natural way of healing. And with that, I would like to close this. Thank you very much for your attention. Please like, share, and subscribe. And until next time, stay healthy.